So look for signs of secondary hypertension and some questions definitely. We all know this is our favorite few things like renal artery stenosis. When we talk about renal bruit, again, my question is, where do we check for renal bruit? In the center, and the sides? So the answer is 2 to 3 centimeter lateral and above the umbilicus. So that's the area we should hear for renal bruit. Now, renal parenchymal disease. So palatable kidney, especially in polycystic kidney disease, because chronic kidney disease most of the time give rise to shrunken kidneys. Coarctation of aorta, so that is a favorite of our medical school, radiofemoral delay, faint femoral pulse, and there is 15 millimeter difference of blood pressure between the arms. But how many times we check blood pressure in both arms? Do we check at all? So I know one of my students once said that she presented a case of this coarctation and Takashus because that patient was having anemia secondary to Takashus, and that's how she come up with the diagnosis of this Takashus disease or coarctation. So very rarely we keep our fingers on our patient's pulse, and we miss a lot. That much I can tell you. Fundal examination, that should be done by an ophthalmologist. Why us? Why the physicians? If you do that, you can get sometimes very important information, and particularly if the patient is suffering from severe hypertension, please go for that. When we talk about obstructive sleep apnea, the questionnaire, we call it stop bang. I think most of you know it, but I'm quickly going through it. So there is a questionnaire with some questions there, whether you are snoring loudly, you're feeling tired all the time. Has anybody observed you? Your sleep is breaking or you're snoring. Your blood pressure is high. Your body weight, BMI is more than 35. Your age is more than 50. And your neck circumference is more than 40, and this gender is male. So these are the questionnaire. If they put tick on 5 boxes, they have high risk. So it is better you involve your colleague who deal with sleep apnea. If you are confident with this polysomnography report and giving the CPAP machine, do that. But your duty is to advise the patient to go for weight loss program. So maybe with diet, exercise, whatever. Now the medicines are not available except one medicine in diabetes. So pheochromocytoma, this again, paroxysmal hypertension. So the problem with paroxysmal hypertension is that when you are seeing the patient, the blood pressure may be very normal. And the patient will complain of palpitation. Oh, most likely thyroid disease then, if the patient is coming with palpitation. We assume a lot, whatever we see, which come up in our mind. But unless you know this could be there, your investigation won't go to that extent. Perspiration, pounding, headache, pallor. But that does not mean in every patient you will check their urinary metanephrines.